Today we're talking about an important topic of 7 early warning signs that you have a blood sugar issue. Let's go. Number 1, you go to the bathroom a lot. Frequent urination happens when you have glucose in your blood. Your body's got to get rid of it, so it pushes it out through the urine. So you start losing a lot of the fluids inside of your body, which is going to create dehydration and a whole host of other problems. This is why diabetes and bad sugar issues are such a problem. But so many people feel like they don't have an issue with it. So if you're frequently going to the bathroom, it might be due to too much sugar in the system. Number 2, you're too thirsty. If you're going to lose all of that excess fluid, you're going to be drinking a lot. If you have excess thirst and pouring in lots of water, can't get enough, chances are you have too much sugar in your system and your body's trying to offset it, or it's trying to recover from the dehydration that comes from frequent urination. Next, number 3, you might start experiencing numbness and tingling. This is a very significant factor in high blood sugars leading into diabetes type conditions. This is 105 million Americans that can be affected by this. So if you're starting to have tingling in the hands or in the feet, the small little blood vessels of your body start to get damaged because of so much sugar in the system, it starts to break them down. That's what creates numbness and tingling. Huge warning sign. Number 4, slow healing. If you're damaging the little blood cells of your body and you get a wound, especially like on your feet or on your hands, the further away from you are of your heart, the smaller the blood vessels are. Because there's so much sugar in the system, it damages those, which doesn't give the blood vessels and the tissue more oxygen. Too much sugar's in the area, the wounds don't heal. So if it's taking time to heal up a normal wound that would have healed faster in the past, you might want to start checking your blood sugar levels and your insulin levels to see where you're at. Number 5, vision. Same concept. Small little blood vessels in your eyes that start getting damaged. These micro vessels start getting damaged first when it comes to too much sugar in the system. So if you're starting to get blurry vision, problems with sensitivity to light or seeing, you might want to take a good look at the sugar levels. Number 6, increased hunger. What happens is that insulin starts to get damaged and the body can't respond the way it's normally used to. Insulin's responsible for transferring energy in your body and taking sugar and moving it into the tissues or using it for energy. But if there's too much sugar, insulin just starts to wear out, starts to get tired. And so then the body doesn't get the sugar and the energy delivered to the cells that it needs. So it responds with, hey, I need more energy. It thinks it's out of energy when in all reality, you're just not utilizing the energy you have. If you have a lot of excess weight, then this is probably an issue for you of insulin sensitivity. It is an epidemic in our country because we're so resistant to what insulin's supposed to do because we have too much sugar going into our system. Number 7, finally, it can be kind of, from a clinical perspective, like these velvety dark patches. And we'll specifically see them kind of like in the joints, but a lot of times like in the neck, the groin, the armpit area. If you kind of have an abnormal coloration of the skin, sort of a velvety feel, this is because of too much insulin in the system. When there's just overproduction of that insulin that's floating around, your body's not used to having that much. It actually changes parts and patches of the skin, specifically in those areas. 7 significant warning signs of you being on your way to major health problems, chronic disease. That is what Dr. Livingood is all about, is preventing that for you. So if I can help you to catch it earlier, or a family member to catch it earlier, you can easily do something about this. Below, I want to leave you some resources of grab one of my books, grab one of our courses, do one of our challenge. We have so many resources for you in as little as 3 weeks. We regularly see people lower their glucose levels, get insulin back under control, lose 10, 15, 20 pounds, and start moving towards experiencing real health. You will be no different, and if you're struggling with these issues, please click one of the links below. We'll help start guiding you through this. You can do it. It's easier than you think. You just got to make the proper choices, and a lot of damage that's initially caused by these sugar problems and diabetes can be helped, can be reversed. But if you wait too long, some things can't be reversed. So I urge you, take action, especially if you're dealing with any of those 7. And if I can help you personally with any questions, please ask below. Myself, our team, we're standing by. We're helping thousands of people, millions of people across the United States, just like you, to prevent chronic disease and experience real health.